Hi, welcome back to my channel again. So this is the second part of the important signs that I was covering. So in this we have a few important signs to cover and then we'll be done with this topic. So starting from the first one, this is called as the cluster. Just give me a second. This is called as the cluster of jewels sign. Now what happens is why this is called as cluster of jewel sign is because there are these string of pearls, right? Can you appreciate there's a string of pearls and they occur in such a direction that new lesions appear close to the margin of the older ones, right? So this is usually seen in the early stage of chronic bullous disease of childhood. All right, now let's talk about this sign. Now this is the you can see the little finger being shortened, so you can appreciate the little finger is shortened. Now this is the dubious sign, and most important, where it is seen in congenital syphilis. Okay, now next sign is very important. So this sign, now you might know it, it's well and good, but let's just know it again. Asbo Hansen sign. So this is the blister spread sign. Now what's so interesting about this sign is what happens is basically when you apply the pressure on the blister, okay, so just give me a second. So pressure on blister is applied, okay, it leads to enlargement of blister, right? Can you see the enlargement? And then it leads to the spreading, so spreading of blister. Okay, so this is Asbo Hansen sign, the third sign. Then coming on to this sign, fourth. Now here you need to appreciate that this is basically these are black hair and we have a white hair band, right? So this is what we call as flag. This is not visible. This is what we call as flag sign. Okay, basically white band of horizontal alternating bands of white. So horizontal alternating bands of discoloration of hair. Now where it is seen is Kwashiorkor, then it is seen methotrexate therapy or sometimes chemotherapy. All right, then this, now you should know this one. This is like very important for you. So these are the fifth. So these are the Forsheimer sign or spots. So this is like most asked question usually. So this is usually seen in rubella. Okay, so in this what you can see is red macules over soft palate. Okay, now coming on to this sign, in this I added a photo of Anna Vande in which she showed that she can touch the tip of her tongue to nose. So this is an example of, like, this is the characteristic of Gorlin's sign, and it is seen in Ehlers-Danlos or hyperextensibility disorder. All right, then this is very important. Now this is like, you will not mostly remember this even if you revise it again and again, but like you have to remember it. Can you appreciate the swelling around the eyelid? So this is the transient edema over upper lid. So this is seventh number. So this is Hogland sign. Just think Hogland was a person and he had this. Okay, and this is seen in infectious mononucleosis. Now next sign is interesting. It is also related to the eyelid. I hope you can make out what I'm talking about. So this is our 8th sign. So this sign is called as the Jelenic. Now, what is in Jelenic sign? Suppose this man's name is Jelenic. Now, what is the characteristic is that he can you appreciate the eyelid of this lady and of this man too. What both of them have in common is that they have the hyperpigmentation of eyelid, right? Now, this hyperpigmentation is secondary to the raised corticotrophin levels. This can occur in other areas of face positive, but buccal mucosa negative. It does not occur on buccal mucosa. All right. Then coming on to this sign. Now this is like very nose which is full of vesicles, right? So can you appreciate like full of vesicles? So vesicles present on nose. So this is Hutchinson's nose sign. This is also same. Okay, then coming on to this is very interesting. So this is 9th. Now this is 10th. Now this basically you have to see this. Now in this first of all just know Russell sign. Okay, this is what it is called. Now Russell sign, why is it like this? Basically it is seen in bulimia. Okay, now bulimia nervosa is an eating disorder in which the person eats a lot of food and then puts their hand inside their mouth, and basically they elicit vomiting to take the food out, right? So when they put the hand in the mouth, the repeated contact of the incisor teeth occurs to like this is from the trauma due to repeated contact with incisors to knuckles in self-induced vomiting. Okay, so yeah, this is important. It is usually asked also. Now this is like the favorite question of examiners these days. So in this you can see something like a necklace, right? Like this. So this is basically very basic. So this is our Castle's necklace seen due to niacin deficiency, a part of pellagra. All right, now see this sign. This sign is also very interesting. In this sign what you need to look for is this, right? Now can you appreciate that we wear shawl in this region, right? So this is, if I have to say, this is the shawl sign. Now this is basically seen in dermatomyositis. Okay, so this is 12th. All right, then basically what you have is you have the violaceous erythema over posterior shoulders. Okay, then coming on to this cute little baby. Now this cute little baby is not so cute. It's looking like as if he has been slapped, right? So slapped cheek sign. Okay, can you appreciate the cheeks, right? So this is like very common, and this is associated with 5th disease, which is the erythema infectiosum by parvovirus B19. So you can see, what you can appreciate is confluent erythematous plaques on cheeks. All right, then coming on to this one. Personally I don't understand why they call this, but for sake of completion, this is carpet tax sign, or it is also called as tin tag sign. Now I'll tell you what does it mean. First of all, just know that it occurs in DLE. Okay, DLE. This is discoid lupus erythromatous. So yeah. So see, as far as I came to know is कि if you appreciate this, right, there are scales and so pattern is there. So this pattern resembles all this. Now this tin tack is basically the pins that we used to put over the board. That is the tin tack. You can Google the image as well if you didn't get it from my thing. So yeah, so these are all the signs that you are needed to know. If you like the video, do subscribe to my channel, and I will be covering various cells also and some of the syndromes. So yeah, thanks for watching.